Great. So thanks again. We're here to talk about some of the potential ART options on the horizon. And, in these conversations, we've talked about some of the metabolic complications that we've run into with long-acting ART and some other complications that arise when patients are on therapy for life. And unfortunately, we have had multiple attempts to try to find something that will allow us to provide long-lasting suppression without daily therapy, and tried therapeutic vaccines and latency reversal agents and passive administration of broadly neutralizing antibodies and checkpoint inhibitors, but unfortunately have been unsuccessful. And so what we're left with is offering patients really effective and safe long-acting therapy that on occasion has complications that we run into, and we either need to modify therapy or think about alternative options. And so fortunately, there are a number of agents that are in late stage development right now. We have islatravir, which is a first-in-class nucleoside reverse transcriptase translocation inhibitor, or NRTTI, which has progressed through phase 2B dose ranging study and is now in some phase 3 studies.
Well, I think the exciting thing about islatravir, beside the fact it's a new first-in-class, it has such a long half-life, right? So people are gonna hear the company, has studies with once a week. They're trying it even as once a month, and perhaps actually the most interesting is the depot as an implant. It reminds us of the old days with CMV and ganciclovir implant, but this is going to be fascinating because, to have an implant and not think about it, I think that is really very awesome. So yeah, what do we know about islatravir? There was a small study, relatively, it's a phase 2B, looking at islatravir doravirine, an NRTI, in treatment-naive patients. So the control was doravirine TDF 3TC. Initially, actually, the first 24 weeks, they had 3TC on board, and then that was dropped. And then what we learned from that study is so far, it looked really good. Efficacy, if you look at the less than 50 virologic suppression, it was very similar in all three arms. If you look at it combined, islatravir, but I think even more importantly, in the one that was chosen to advance, the 0.75, numerically it was higher than the control, but it was really very effective. And when we looked at metabolic complications, I presented the data a couple of times, we saw, little bit of lipid advantage with the TDF arm. But in terms of body composition, it was very similar to the TDF 3TC doravirine. And, based on what we discussed, TDF has a weight suppressive effect. Yeah. So if you tell me a new drug is similar to an arm that has TDF, actually, that's a good result for the new drug, for the islatravir arm.
Especially in treatment-naive patients where we're, anticipating some healthy weight gain as well.
Exactly. So between the healthy weight gain that you expect and between, having TDF as the comparator, it was really good that we saw a similar increase in weight and fat depots. And in terms of bone, as you expect, the TDF arm was much worse. There was a difference between minus 1.5 and minus 2% being worse in the TDF. So it looked really good. I think very good for islatravir as a first naive study with islatravir. So we're looking forward to the follow-up, to the phase 3, to see how it fares in naive patients. So if I could mention actually one other thing, obviously, the PK data looks good. I think it's going to really be ideally either an implant or a once a month. Our patients, once a day now is like, once a day. Yeah, it's too much to take a pill.
And the islatravir doravirine, even though it has such a long half-life, the doravirine still requires it to be once a day.
Exactly. So I think the most exciting is, perhaps once a month, if you can team it up with a drug that will be good once a month, but even better as an implant, right? Yeah. And the exciting thing for implant could be used for PrEP as well as treatment in combination perhaps with another drug. And one of the most exciting drugs to team up perhaps with islatravir is the new capsid inhibitor, lenacapavir. So that one we have a little bit of data on.
Yeah, so with lenacapavir, again, we just have the week 28 results, but again, really encouraging efficacy results. And I think what's most exciting and promising about lenacapavir is the long half-life and the possibility of having this as an implant. We're looking forward to seeing the results, the longer-term results in treatment-naive patients, and then there are also ongoing results in the treatment-experienced patients.
And lenacapavir, to me, is amazing because you know, the one study that was done looking at the experienced patients, we're so used when we have somebody who failed several regimens, you put them on a study and you're happy with, remember, 50% virologic suppression, say, oh, that's good. You know, this is a tough population to study. So in this study, what amazed me is that the virologic suppression was in 81% of patients overall. I mean, that is amazing. When you just add one drug, lenacapavir, to the background regimen chosen based on genotype. And even worse is people who had no option, so no active drug, they added lenacapavir. And still, even though it's a small number, but 2/3 of them achieved virologic suppression. One drug. So I think, hopefully we'll see it even approved for treatment experienced. It's under review by FDA. But I think it's amazing that we got to a point that even in patients who had a lot of virologic failure in the past, you can add even one drug, potent drug, and achieve virologic suppression in such a high number of patients.
Yeah, it's, we're at the stage where, I feel a little bit sad that when my patients come in and ask about a cure, or, why we haven't found a cure or a vaccine yet. And that's always a humbling conversation. But the fact that we have two new first-in-class medications, which are going to be potentially options for both treatment naive and treatment experienced patients, and really relieve a lot of the stigma and the other complications that they experience, is so exciting right now.
Yeah, you're right. Makes the conversation, less pessimistic, because you're right. They ask about a cure. It's like, no, not really. So far, no major advances. However, your life's going to be much easier. I do think it's such an optimistic time. And every meeting, we're looking forward to hearing what else they have to show us about the long-acting agents. So it's a very exciting time.
Yeah, we're looking forward to the longer term phase 2 data, and then even some of the phase 3 data that's going to be shortly coming up.
Absolutely.